Well, now to Health Matters, and is this topic even real? We are talking about the long-running debate. Should you and, well, can you actually eat your placenta after your baby is born?
And more importantly, for us right now, a lot of people say, what? Why? Why would you want to do that? Well, joining us to answer that and other intriguing questions is the intriguing Dr. Vic. Dr. Tom Rushton from St. Mary's Medical Center. Thanks for joining us. Did you come up with this topic?
No. I have one of my staffers, my nurse, is expecting, and she came across this story, and I said, we need to share this. So shout out to Kayla. Thank you.
Thanks, Kayla.
Thanks, Kayla.
And if it's good enough for the Kardashians to talk about, it's good enough for us.
Hey, why not?
There you go.
Yeah.
Okay, so the obvious question for people who haven't heard about this, you know, why
even do it, right? So if you think about the placenta is protein. And once the baby's born, it is going to, that'll be the second delivery, if you will. And why let it go? Why waste it? If you don't have a good protein source, you don't want to throw it away. And so traditionally in those cultures that would do something like that, they would then cook it up and eat it.
So health benefits, I mean, is there anything to it other than the protein?
No.
Okay.
No, there isn't. Especially, you know, for most of us, I would still favor that traditional steak dinner.
Right.
And I think that's, you know, makes a lot more sense to me. But nonetheless, for some patients, they're not going to have that option because it has to be sent to pathology. The obstetrician saw something funny about it, and so that's not going to be an option. But otherwise, it could be an option.
And it's kind of become, I mean, we joked and mentioned the Kardashians, but it's kind of become an it thing to do, an it thing to at least talk about, an it thing to debate about whether or not to do it. So it's now become a hot topic then. Once it becomes something that maybe Hollywood starts to discuss and celebs start to discuss, and that's where, I guess, pardon the expression, then it feeds itself.
Correct. And when that occurs, then you start thinking about, well, how would I cook up my own placenta? There are companies out there that will help you with that problem.
Of course there are.
Yeah, I was going to say, how does it even work?
Right. So otherwise, you would take it home with you, and you probably freeze it, and then at some point you take it out and you cook it and eat it. All right, that's straightforward. I don't have a problem with that. We do need to remember that as this placenta is being delivered, it is coming down the birth canal, and it will have bacteria on it.
Sure, absolutely.
All right, so we cook it, and that's fine. But there's at least one company out there that will take the placenta, they'll grind it up, and then they will package it in capsules. And then down the road,
oh, there it is, right there.
There you go.
Okay.
And then what you do is you swallow all those capsules. Now, again, I think if we have to go through this much work, we probably should be thinking about whether we ought to be doing it in the first place.
Right.
But the CDC recently investigated a case where both mother and child ended up getting a Group B streptococcus infection.
Oh.
And
from this?
From this.
The pills.
It's what it looks like.
Interesting.
They could find no other connection. And the thing to remember here is that Group B streptococcus is a feared complication of pregnancy. And that's why a woman will be tested in the middle of pregnancy and then at the point of pregnancy. And then be treated with antibiotics. And in this case, she was in fact positive for Group B streptococcus. And both mother and baby ended up getting treated because it looked as if this was a new process, a new infection there. The placenta was then harvested and then sent off, probably not heated to a point where it was actually cooked.
Yeah.
It did not destroy the bacteria there. She ingested the placenta in the capsules. She got Group B strep, and then the baby got Group B strep as well.
Oh, wow. So I guess my question is, I mean, this isn't a new topic, but it's something that we've been talking about lately. And for the women out there that are even thinking about doing this, I mean, what is your recommendation? Being a doctor, do you think it's safe? Have there been enough studies on it? Yeah.
I think there's so many other options, and there's not going to be anything more to this practice than, like I said, having a good filet mignon.
Okay, it's fair enough. Yeah. I think the questions will, and don't forget, if you are of the mind that you think, no, this is the way to go, I've done this, there's nothing that he's going to say or that you'll read on Google that might change your mind.
Yeah,
if you are convinced, and I'm sure you've talked to patients before, not just about this, about anything, where you say, that's not such a good idea, that's my opinion as your doctor, and they'll say, okay, thanks, and they go out and do what they want anyway.
And I say, get a good thermometer, good digital thermometer, make sure that placenta is above 160 degrees Fahrenheit.
160, okay.
And you should be fine.
As if you were cooking regular meat.
That's exactly right. That's what it is.
Okay.
Thank you very much for joining us.
As always. Thank you for that riveting conversation.
I never thought I'd it before, but it's interesting, and a lot of people are talking about it, so I think we should too.
Exactly.
Thanks, Dr.
Thank you.